Imagine that you can't type a message on your phone. Take a spoon in your hand to eat your favorite soup. Write a note to your loved one on the refrigerator. Or just get up from the chair and take a few steps. As a student, Maria Zivik developed rheumatoid arthritis, which made her a hostage of her own body. For several years until she started taking therapy, she lived with a constant feeling of pain, and even at her own wedding. Because of this, she almost fainted. Maria's monologue is a cry from the soul of a girl for whom elementary movements have become painful. Rheumatoid arthritis is an autoimmune disease of unknown nature characterized by a chronic inflammatory process in the joints and damage to internal organs. The patient becomes puffy and the volume of movements decreases. Chronic inflammation leads to the destruction of cartilage, its deformation. It is one of the most severe autoimmune diseases in humans. Autoimmune refers to the process by which the immune system begins to attack itself. Women get sick more often. The ratio of women to men is about 3-to-1. The disease develops in all recurrent groups, but the peak falls on the most active and able-bodied age, 35 to 55 years. Despite my illness, I quickly found a job and tried to live a normal life. But very soon, she became a hostage of her apartment and her body. She could not go anywhere. In the morning, I lay in bed for a long time, waiting for the stiffness to pass. I had to quit because I couldn't physically perform my duties, even just fill out papers. Imagine, you hardly move from room to room, unable to hold a spoon, fork, toothbrush, pencil in your hands. Your fingers just unclench from the pain. My husband helped me get dressed, button up, use the toilet. I say imagine, and I understand how difficult it is. After all, in the consciousness of our society, rheumatoid arthritis is a disease of the elderly. Maybe that's why, being ashamed of their condition, people with such a diagnosis rarely talk about it. Even my family can't always understand my condition. When I tell my husband, "It hurts like this," I describe the level of sensations. He replies that this cannot be. If this is true, you should lie down now and not move at all. Rheumatologists evaluate the degree of pain sensation on a scale from 0 to 10. Patients are asked to name a figure corresponding to the level. When I had not yet been diagnosed and prescribed treatment, the hands were huge, the fingers did not bend. It seemed as if the skin was about to burst. And believe me, a scale from 0 to 10 is not enough. I couldn't think of anything but pain. And the morning began with a quest, how to get out of bed. The feeling that a tractor drove over me, or that all the joints were crushed with a hammer. So everyone tried to treat me. There came a moment when I lost hope, realized that I didn't want to live with this pain anymore. And just at that time, doctors were found who took responsibility and made a diagnosis based on symptoms, not tests. Drug therapy began, and immunosuppressive drug was prescribed. It is also used in chemotherapy, but in much larger doses than in autoimmune diseases. Within 6 months, I began to feel quite tolerable. About a year after the diagnosis, I went to the office and almost returned to my old life. Somehow in the autumn, I felt stiffness again. Swelling of the hands appeared. The doctor was far away in another city. And I'm all about work. A vacation in hot Egypt loomed ahead. Well, it wasn't up to that. And suddenly I remembered that when they couldn't diagnose me for a long time, they gave me a magic injection in the hospital, after which I practically fluttered. I found an extract, calculated the drug. It was from the group of glucocorticosteroids. She began to stab, intramuscularly, on demand. At first, the truth fluttered, then the injections became more frequent, and the effect became less pronounced. I remember well the early morning of January 1. Such a bedside table with thin handles and skinny legs. I cried, pulled myself together, and stopped self, medicating. Only then I realized how I risked my health. The drug had a lot of side effects from mental disorders to adrenal insufficiency, which can turn into an acute form. I went to the doctor to adjust therapy. Finally, she came to me. Sport has returned to my life. Of course, I gave up the idea of skydiving after I learned what it means to be practically immobilized from hellish pain, stiffness, and puffiness. But there were no bans on swimming, and for example, stretching. You can even work out in a fitness club, but carefully and with a mandatory warm-up. After another 10 years of stable remission, I decided to give birth. On drug therapy, pregnancy is a contraindication. If you take medications, contraception is mandatory. Some doctors did not advise having a child at all. But during remission, I decided on a choice, left work in advance to prepare the body and get rid of stress, changed the treatment to a less aggressive one. The pregnancy itself proceeded quite well, but I was constantly under the supervision of a rheumatologist-gynecologist tandem. Immediately after giving birth, I started therapy incompatible with breastfeeding, so my son is an artificial from birth. But nevertheless, the aggravation overtook me, however, 6 months later. I couldn't dress him properly, take a walk with him. My nerves were on edge, and at that moment a psychotherapist helped. Then it turned out that none of the basic therapies helped me anymore. Leukopenia began, and I started the process of getting a disability so that the state would provide me with a genetically engineered drug. An expensive medicine, unfortunately. So far, our society does not know anything about this disease at all, except for those people who have already encountered it. But despite all this, I believe that rheumatoid arthritis is not such a terrible limitation if you are in remission. You take medications, and that's it, you're no different from the rest. Sometimes people are diagnosed, they get depressed and think that life will not be the same. But understand, it can be remedied. There is enough desire and a competent doctor nearby. But I would not recommend experimenting with treatment methods. Rheumatoid arthritis is a systemic disease. It is important to start therapy on time because joint changes, unfortunately, are irreversible. The disease is incurable, but in some cases, it is possible to achieve stable remission, which allows patients to live a normal life, work, travel, start families, have children. A significant share of responsibility falls on the patient himself. This is strict self-discipline and self-control, daily adequate physical activity, physical therapy, rehabilitation. All this in total allows not only to lead the patient to the desired goal, stable remission, but also to avoid complications in the future.